As this disease spreads and concerns grow, how are local health officials preparing for a possible outbreak in our area? Fox 10 News reporter Matt Barentine has the answer in tonight's special report.
Is closing schools and wrecking vacations.
All we were handed was a slip that said the swine flu, and we don't understand how, if they were that concerned, they should have been triaging people.
And the best advice anybody has to fight this flu is the same advice our moms gave us years ago.
The most important thing is hand washing.
Wash your hands.
Wash your hands.
Need to wash our hands.
But what exactly is the culprit behind all the concern? Under a microscope, the swine flu looks like any other flu. More properly called H1N1, this virus has more than just swine in it. There's also human and bird strains in the mix. What's really different about this virus is that it's new.
Strain that's not been seen by our population before, so more people can get sick.
Most importantly, scientists say H1N1 is missing a key amino acid that more lethal flu viruses have. So that means we have a chance to fight back. They're called antiviral drugs.
The good news with Tamiflu is of the 4 antivirals that are known to treat the flu, this H1N1 virus does respond well to Tamiflu.
When the flu or any virus infects a cell, it hijacks the cell and forces it to replicate more virus. Shown here in these little blue dots spreading out to other healthy cells in the body. Now, how Tamiflu works, it creates a protein barrier around the outside of the infected cell that traps those viruses inside the cell and doesn't allow it to spread to the rest of the body. In this way, Tamiflu eases symptoms and shortens the length of infection. In Florida, 500,000 doses of Tamiflu are ready to go. And in Alabama, 700,000 doses are being positioned around the state.
We are in the process now, running through Montgomery, pushing the supplies out to our regional distribution centers.
This is the state public health view where they can...
David Wallace, who trains Alabama officials for health disasters, says the state is already tracking any potential problems.
We track hospitals, community health centers, nursing homes, all of those facilities that have some degree of patient care.
The state is using a program called the Alabama Incident Management System, or AIMS. Originally designed for a bioterrorist attack, the system only needed a little tweaking to deal with swine flu.
We can filter this information by state, by area, by county, all the way down to the individual facility.
Each time hospitals send in information, the data is updated, so emergency officials will know where the hot spots are and where to send help.
So it's as close to a real-time disease surveillance tool as there is out there.
With a disease that spreads in real time, good tracking and good drugs are the best defenses we have. In Mobile, Matt Barentine, Fox 10 News.
With summer on the way, the number of flu cases in the U.S. will likely go down. But health officials are worried about it flaring back up again in the fall when the flu season begins again.